So, unfortunately, we have to report 2 more county residents passed away and lost their battle with COVID-19 last night. 2 women, both in their 90s, not residents of Shaker Place. But my heart breaks for the latest families that have lost a loved one. My prayers and condolences go to the family, to the 158 other families that had to go through this difficult time. Please, people, take the time, take a step back, and as bad as things have gotten, will get, think of these people that have lost loved ones during these more difficult times. So, again, our prayers and condolences go out to the 2 family. But that's the 10th new death here in Albany County in just 1 week. We had 18 people pass away in November, so that means more than half of all our deaths happened in last week alone. So just to try to put it in a point of view of where we're at and where we're headed. So to everyone out there doing the right thing, thank you. Thank you, thank you. And I know there's a lot of people out there doing the right thing, and it's hard when you see people not doing the right stuff or wearing the mask, or if you going to a store and someone's walking around with a mask and you're looking for the workers to say something. You know, I do say to everyone, conflict doesn't resolve the issue. You can talk to them nicely. You can ask them to put their mask on and call, and do the right stuff. But if they're not, you're better off walking away. And like I said, go out, leave that store, or wait for the store employees to do something. It's difficult, and it's a lot of complaints that we get. To the people that don't believe in the science, that don't believe in the data being put out there, or what Liza and I continue to have say for almost 9 months now, education is the most powerful weapon which you can use to change the world. Nelson Mandela. So, think about it. Educate yourself in the facts. Go online, read everything. Find out what's going on around you and be part of the solution, not part of the problem. And we'll get through this by working together in a partnership and being there for one another. And if there's something that we're not doing right, let us know. We'll try to adjust. And if we agree with you, I put it out there. The data continues to change. The way this is affecting us this time is changing more now than it did before. And we have to adjust. You have to adjust, adapt to the situation, and to protect the residents of Albany County, because that's our job. But today we have 2,370 people currently under mandatory quarantine. We have an increase of last night of 159 positive cases overnight. That is the highest we've ever been. The last was 147. So we are at 159 people that are positive. We also know 22 had close contact to positive cases, 11 are healthcare workers, and 127 don't have a clear source of infection. As of today, 23,598 people now completed quarantine. 4,971 tested positive for the virus and have recovered. That's an increase of 112 recoveries since yesterday. We hit another sad milestone with today's hospitalizations number. There are now 76 people currently in the hospital from this virus. Once again, most we've ever seen in Albany County. There were 6 new hospitalizations just overnight. This is now the 5th time in just over a week that we set our record for the number of residents in hospitals. This is now the 5th time in just over a week that we set that record for the number of residents, yet we have 72 residents in the hospital, and on Sunday there were 67. Our hospitalization rate is now 1.29% of those who have tested positive, and yesterday that rate was 1.25. 12 patients are currently in the ICU. Yesterday that number was 11. The day before that was 8. Over the last 5 days, there's been an average of 112 new positive cases each day. Yesterday, it was 100.4. We continue to monitor the data ahead of the possibility of Albany County or parts of it entering to the microcluster. New York State Department of Health announced yesterday that it's updating the matrix that would qualify an area of the zone and what's it going to look like. So it will now be just the 7-day rolling average for percent positive rates, numbers of new daily cases per 100,000 residents. yes, I know it gets confusing, and we're throwing a lot of stuff out there. Take the time, go on our website, read this, go to the state DOH and read it. Matrix will also now include hospital beds capacity, including ICU beds, hospitalization and death rates, and available hospital staff that can care for sick patients is all going to fall into the matrix now. We are one of the largest regions who haven't been targeted with a micro-cluster zone so far. You've seen in New York City, Hudson Valley, Long Island, in Western and Central New York, and Southern Tier. Albany County and the Capital Region could be the next, depending on how exactly the state sets these benchmarks. On our control room today, we will find out more of what's going on and what these new guidance mean going forward. As it changes, like I said, we have to continue to change with it. And it actually brought me to another interesting quote. Americans always do the right thing once they exhaust all the possibilities. Winston Churchill. And it's the same thing. To the people not doing the right thing, we're going to continue to exhaust all of our resources and continue to adjust. But we need you to stand with us shoulder to shoulder to get through this. And we will get through it. And it's going to be a difficult couple of weeks for all of us here in the county. Trust me, you know, like I said yesterday, the way we're seeing these numbers go and the directions of hospitalizations, there will be light at the end of the tunnel with the vaccine coming out, but we need your help to get there, and we need you to be vigilant, and we need you to continue to do the right thing and stay at home. Please stay at home if there's no reason to go out. Only go out shopping when you have to, and do the right thing while you're out there. Looking at our percent positive rate, Albany County 7-day rolling average now hit 4.1% using the data from November 29th that comes during our daily percent positive rates, all the way up to 4.8% on Sunday. The 7-day average for the Capital Region now is 3.24%. And again, we don't know exactly where we stand on the other matrix based on the state, you know, the state looking at it. But we used the COVID-19 regional dashboard that was used during the reopening process, if people remember that from 9 months ago, or that was probably 6 months ago, actually. You can track some of them. The severity of the infection in the Capital Region is 1.66% per 100,000, which is one of the lowest in the states, but it's also trending upwards pretty quickly. Our share of hospital beds availability is at 30%, which has been pretty consistent going all the way back to April. And our share of ICU beds available is about 45%, which is a strong number also. We've yet to see the full effects of Thanksgiving. We have the holidays coming up soon, and we'll likely see infections continue to go up, which is very likely pushing our hospital numbers continue to go up. No, up and up. Same thing with the positive rates of COVID-19. So ultimately, the best way to protect yourselves and others to prevent us from going into the microcluster is to go out less, avoid large gatherings, wear masks, wash your hands, cough into your arms, and stay 6 feet apart. This is especially true as the weather continues to get colder. More and more people are focused on spending time inside in close quarters. So please do the right thing when you're doing that. And if you have people over, if you have to have people over that are your immediate family that live in that house, stay 6 feet apart and try to do the right thing and keep your mask on. Dr. Whalen.
Good morning. So the fact that we've hit a record number of cases per day and a record number of hospitalizations is deeply concerning, and it is my fear and my likely projection that this is just the start of a major upswing in cases and hospitalizations that we'll see throughout the month of December. I think, as the county executive indicated, we have not yet seen the full brunt of what has happened over the Thanksgiving break as a result of people that maybe got together for family events. We are learning at the state and national level that these small gatherings are really turning into the drivers of infections. So I would encourage everybody that up to now said, well, I'll just visit with 5 or 6 people, or I'll visit with 10 people in a house, it'll be small. Realize that that's where you really are most at risk. when people let their guard down. And it is essential to curb those kind of interactions to the extent possible, and if they're absolutely necessary, to remain masked in a home and keep your distance if you're not with the people that you live with on a daily basis. I would also reinforce the message from yesterday that if you did attend a large gathering over Thanksgiving to be tested, to be aware of the fact that you could potentially be spreading COVID, although you yourself may be asymptomatic. It is very important that you know your risk so that you can behave accordingly. Having said that, all of us should be acting like we are at risk with every interaction and act accordingly. I don't like to have to give messages like this. I find it very difficult. I think people are looking for good news. I think people are looking for some hope. We do have the vaccine on the horizon, but that is not a sense of security right now. Now more than ever, people need to buckle down in terms of how they protect themselves and their families. I will say I've gotten questions on, you talk about masks and social distancing and washing your hands and all the things that we've heard about daily for the past 8 months. Are there other things that we can be doing to help protect ourselves and our families? And I know several times I've mentioned the importance of just looking at your general health and making sure that if you do have chronic health conditions, those conditions are optimized. We know that people with asthma are at risk. We know that people who have heart disease are at risk, people with diabetes. So those individuals in particular, and anyone with any chronic health problem, really needs to make sure that your health problems are being maximized. So are you on the right medication that is controlling the numbers your doctor follows to monitor whether it's your blood pressure or your episodes of asthma or your blood sugar? These are important steps that people can take to make sure that their general health is good so that they don't put themselves at higher risk of suffering complications and hospitalizations if they do come down with COVID. So this is an important preventive step that I'd ask everyone to consider. We also are learning more about the role of some vitamins, and I'll mention this morning vitamin D, which is a vitamin that most of us in the Northeast are deficient in because we don't have much sun in the winter, and vitamin D is generally manufactured in your skin when you are exposed to sunlight. So it is a common problem that many people in the Northeast and in other cold climates have, that they become vitamin D deficient. And this is a level that can be checked via a blood test if you're going for a routine physical examination. But generally, small doses of vitamin D, even if you're not deficient, can't hurt and may help. So in terms of how you take vitamin D, it's available at pharmacies. Vitamin D3 is a supplement that is more easily absorbed than others, and usually between 600 to 800 international units a day is something that we're hearing more about. Research is evolving in terms of it. Those with vitamin D deficiency having potentially more risks of complications. So while this is still evidentiary and evolving, I think it's one of those things that could help and is not likely to hurt you. If you have questions that you want to discuss with your doctor on this, I would encourage you to do so. But just going back to the general preventive measures that you can take, in addition to the public health measures that we discuss, it is important to make sure your general health is well taken care of, and that you are optimizing. I know a lot of people are smokers, and of course, when we're under a period of stress, it is very difficult to consider stopping smoking. People that have issues around weight, it's similar. But if those issues can be looked at and can be managed, they can, again, give you better health to prevent you from having complications if you do develop COVID. Yesterday the governor's press conference was really all about how we are looking at hospitalization metrics and how we are concerned about hospital surge capacity. And this is, the the worst case scenario that we have looked at in Albany County and that we want to avoid is the fact that our hospitals could get to the point where it's difficult to take care of patients because of the sheer volume. We're not there yet, but we see on a daily basis our cases are increasing, and this is a significant concern given the upward trend of cases that we're seeing. So again, the messages that we have been sharing on a daily basis, I think the majority of people that watch our press conferences are probably the people that are doing the right things. So utilize your voice, really spread the message of education. Again, it's not helpful to necessarily fight with people, but to encourage people to learn. This is not the flu, it's not influenza, it's not the same kind of virus. The cases that we're getting are laboratory confirmed positive cases. They're real numbers, they are real people that my staff interacts with on a daily basis. A lot of these people are suffering, a lot of these people are sick. You don't want to be one of these people, so please act accordingly and protect yourselves and your family. Again, I would reinforce avoidance of small gatherings, testing as necessary if you're exposed, and optimizing your general health. As we said yesterday, the systems that we have in place, we have prepared for surge, but the systems are not infinite. And we at the health department are finding that now we are having to, change our workflows a little bit so that we can get to the volume of cases. It's a big challenge. It's a big challenge even with increasing staff, even with an abundance of volunteers. It is changing the way that we have implemented our outreach. And we continue to look forward to that. The challenge of reaching out, providing the information that the public needs if you have been diagnosed, on isolation, how you isolate safely at home, if you are a contact, how you conduct a quarantine period. But those are things that the general public should now also start to learn about themselves in preparation, so that you can be prepared. It is likely that you or someone you know will be affected by this going forward. Probably for many of us has already occurred. Everyone needs to learn, everyone needs to be educated, and everyone needs to do their part. Thanks.
Thank you, Dr. Whalen, as always, and great advice. So please help us stop the spread, get testing, and we have great partnerships with Whitney Young, and including the Times Union Center, which will be there December 4th, and our site in Waterville Elite, our mobile testing site that's going to be in Waterville Elite. We also now are offering drive-thru tests along with walk-up testing that we've had. So testing by appointment, you can call at area code 518-465-4771. We cover the cost if you don't have insurance. So I know that's an issue with certain people, and trust me, we do it, and the State Department of Health at UAlbany does the same thing. So thank you for what they do day in, day out. You can go to UAlbany at 188-364-3065. We also have Price Chopper, CVS, Purdy One, Walgreens, and plenty of other choices. Please go to albanycounty.com, and you can use the mapping feature to find the closest and most convenient test for you. Yes, we did. I know Walgreens on Holland Ave was booked for 3-4 days this week already. I know appointments are being pushed out. It just shows you the variety of people getting tested. Either one, listen to Dr. Whalen and I, or two, did the wrong thing on Thanksgiving and now are trying to forensically make sure that they test negative. But please continue to do the right thing. We'll get through this, and there's light at the end of the tunnel, and we just need to take a step back. Like I said, it's a marathon, not a sprint. We've been in this for almost 9 months, and we're almost there. The vaccine's going to be there. We can do this together. That's what I love about Albany County and the Capital District here in the state of New York. We got a little COVID fatigued, but now we need to just re-energize our batteries a little bit and readjust and just be more vigil going out, and trust me, we'll get through this. We're going to get through this, and it's going to be a tough couple of weeks, but trust me, working together, we'll get through it. We have our mental health support line there available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. And our great partnership with United Way and Pete Gannon, 211. And our New York State hotline, 188-364-3065. Please remember, all the services are out there. For substance abuse or meetings are still going on, and we got to figure that out to keep them meetings going for people that need it with drug addiction or alcohol. We'll get through this working together.